Hello everyone, welcome back once again to our PLAB 1 Psychiatry series. And for today, we are going to have a discussion regarding a condition called anorexia nervosa. So, whenever you get a question regarding anorexia nervosa in your PLAB 1 examination or PLAB 2 examination or clinical scenarios, uh, it is quite a straightforward case. You can come to the diagnosis by the presentation of the condition itself. So it is quite straightforward, but the tricky part is the management part of anorexia nervosa. So basically in this lecture, I'm going to mainly focus on the management part of anorexia nervosa. And so whenever it comes to the management of anorexia nervosa, it is not always about referring the case to the eating disorder unit or referring the patient to the psychiatry ward or psychiatry unit. If you are not watching this video till the end, so I'm going to give you a very short tips or clincher, I'll say, before you come to the management part. Please remember three things. So what are the three things? The three things are: please check whether the patient is having a acute medical condition or not. Like if the patient is having a severe metabolic disorder or severe electrolyte imbalance or bradycardia or any life-threatening condition, please be sure that patient is not having any acute psychiatric condition. Like please check whether the patient is at high risk of suicide, or whether the patient is having a thought of self-harm, whether the patient is a threat to himself or herself or to the community. Then you need to be aware of that situation too. And the third thing is, please, whenever, if there is a BMI is given, if the BMI of the patient is given, keep an eye on that, keep a bull's eye on that, because these three things can lead your management to the whole another direction. So please remember these three things before you formulate the management for that particular patient. So without further ado, let's jump into the topic. Let's have a little bit of a detailed discussion regarding anorexia nervosa. So how the case of anorexia nervosa present? So anorexia nervosa is present usually in adolescent group, and the typical case is a adolescent female or a lady of age 13 to 17 years of age most of the time, and she is having a intense fear of being obese, or she have a intense drive for thinness. And for that, what she is doing is she is having a self-induced weight loss mechanism. And what are those? The patient is reducing the food intake. The patient is having a self-induced vomiting or purging, or she's doing a lot of exercise to lose weight. The first thing is adolescent age group. The second thing is patient have intense fear of being obese, or she wants to have a thin, or she has a intense drive for thinness. And the third thing is she is having a self-induced weight loss mechanism. And the fourth presentation, and the most common the presentation is the patient is having a BMI of less than 17.5 kilogram per meter square, or it is less than 85% of that expected weight for that age group. So whenever you get a case of anorexia nervosa and the BMI is mentioned, please keep an eye on BMI, because it will differ the management of the patient. And for the anorexia nervosa, 17.5 is the magical number. So if you don't like to remember anything about anorexia nervosa, please remember three things that I've said earlier and keep an eye on 17.5. BMI, it is a sort of clincher because you can figure out the case easily for anorexia nervosa, but for the management part, it is important. And what are the other presentation? As the patient is not having a food properly, and she is doing a lot of vomiting, and she is abusing purgatives or purging, or she is doing a lot of exercise, that comes with the cost of hypotension. The patient might present to your clinics with hypotension, or patient might land up in your ER with a funny sensation in her chest, or palpitation, or bradycardia, or a fatigue and muscle weakness, this sort of presentation. So what is the difference between bulimia nervosa from anorexia nervosa? So bulimia nervosa is another eating disorder. It sounds similar, but it is quite opposite condition. And in bulimia nervosa, the patient have a repeated episode of uncontrolled overeating. Here, the patient is doing repeated uncontrolled overeating. Then the patient feel guilt about her intake of calories, or intake of lot of food. Then what she does is the patient adopt a weight loss mechanism because she felt guilt about all the overeating. Whereas in anorexia nervosa, patient is restricting food just to stay thin. She don't like to get obese, and the patient is restricting food here and doing a lot of exercise or self-induced vomiting or laxative or diuretics misuse just to stay thin. Here the patient is not taking food or doing or overeating in anorexia nervosa. Whereas in bulimia nervosa, the patient is having uncontrolled overeating. Okay. The next thing is, please remember the magic number 17.5. If it is the BMI of the patient is less than 17.5, it is likely that patient is having an anorexia nervosa. And if the patient is having a BMI of more than 17.5, it is the likely case of bulimia nervosa, because patient is overeating most of the time, and so she maintains her BMI above 17.5. And in examination, you might find a parotid swelling, which is peculiar for bulimia nervosa. So whenever you get the case, please differentiate these two eating disorder, and for that a very important clincher is BMI and uncontrolled, or the eating pattern of the patient. If it is uncontrolled overeating, then it goes towards or inclined towards the bulimia nervosa. Whereas if the patient is self restricting a food just to lose weight, or she has that intense drive for thinness, then it is the case of anorexia nervosa. Okay, so we are going to discuss the very important part, and that is uh, management part of anorexia nervosa. So let's come to the management of anorexia nervosa. So the first category of the patient, we are going to manage those patients in acute medical ward. So if the patient is having a life-threatening condition like severe electrolyte disorder or bradycardia or hypoglycemia, etc., then we first are going to manage that case in acute medical ward. So who are the patients that we are going to manage in psychiatry ward? Those are the patients who are having a risk of self-harm, or the patient having a high risk of suicide. Then the patient should be admitted to the acute psychiatry ward. All right. And the third thing is, there are few patients that we are going to refer those patients to the eating disorder unit with urgent referral. So who are the patients that we are going to refer to the eating disorder unit urgently? So those are the patients who have a less than 15 kg per meter square BMI. So if the patient have a BMI of less than 15 kg per meter square, if the patient is losing weight rapidly, rapid weight loss, and if the patient have evidence of systemic failure, then we are going to refer the case to the eating disorder unit urgently. So, and the last category is we are going to refer the patient routinely to the eating disorder unit. These are the patient who have a BMI of 15 to 17.5 kg per meter square, and there is no evidence of systemic failure. And the third thing is, you can refer those patient either to the eating disorder unit routinely or local community mental health team. All right. So let's summarize our management. For the case of anorexia nervosa, there are four categories. You are going to differentiate the patient in four categories whenever you get a case of anorexia nervosa. So what are those four categories? First, remember, if the patient has acute or life-threatening medical condition like severe electrolyte disorder or bradycardia or hypoglycemia or anything emergency, then you are going to manage that case right away in acute medical ward. You stabilize the case first in acute medical ward, then you hand over that case to the psychiatry ward. First category of patient. The second category of the patient is whether, please be sure whether the patient have a self-harm, thought of self-harm, or whether the patient is having a high risk for suicide. Then you are going to manage that case in acute psychiatry ward. You are going to admit that case in acute psychiatry ward and manage accordingly. So come to the third categories. Third category of the patient is if the patient have BMI of less than 15 kg per meter square. If the patient is having a very less BMI, that is less than 15 kg per meter square, the patient is losing the weight very rapidly and there is a evidence of systemic failure, then please refer the case urgently to the eating disorder unit. It is the urgent referral to the eating disorder unit. All right. The fourth category is the patient who have a BMI of more than 15 and within 17.5 kg per meter square, that is 15 to 17.5 kg per meter square of BMI. If the patient don't have any evidence of systemic failure, then you can refer the case to the eating disorder unit routinely, or you can simply refer those cases to the local mental health team. And what you can do is you can suggest the patient for a self-help book, and sometimes you can say that the patient can maintain the food diary and so that they can help themselves and get a trace of whatever they are consuming. So this is it for the management of the case anorexia nervosa. You are basically, whenever you get the case of anorexia nervosa, categorize those patients in these four category and manage or choose your answer accordingly. Okay. So let's do some practice question. It is a very short question just for the practice. So question number one, you can see that a 20 years girl with amenorrhea and BMI of 14 still think that she has to lose weight. What is most likely diagnosis? The diagnosis is always a straightforward diagnosis. BMI is less than 17.5 and the patient has endocrinal disorder, adolescent age group and the lady. So the case is simply anorexia nervosa, and because she thinks that she still need to lose weight, it is not bulimia nervosa, she is not overeating, it is not OCD, it is not depression, and it is also not the body dysmorphic disorder. Okay, so the correct and most appropriate answer is anorexia nervosa. And the second question, you can see a 19-year-old female brought by her parents, and they are concerned about her BMI, which is 12. Okay, and she is satisfied with it. What is the next step? So, adolescent age group and BMI is very less, 12, and she's though she is satisfied, what is the next step? So, let's discuss. Okay, the BMI is less than, please remember, BMI is less than 15. So, it is the appropriate answer is urgent EDU referral. Okay. Acute, medical admission? No, because there is no any medical condition or no any acute medical condition to be managed or to be stabilized. The patient is quite stable. So this is the wrong answer. Start the antidepressant. She is not having any depression. So we are not going to start the patient right away with antidepressant. Social service? No, it is not likely that it is the patient is having a family issues or non-accidental injuries, or the suspecting we are not suspecting the case for abuse, so we are not contacting a social service here. And the answer here is the psychiatry referral for admission, because the patient this case is of psychiatry and the patient is having anorexia nervosa and the BMI is very very less. The even the most appropriate answer is urgent referral to the eating disorder unit, or you can right away refer the case to the psychiatry for the admission. I hope you find this video very helpful. Thank you so much for watching this video till the end. Please consider subscribing to our YouTube channel, and we will be coming up with more videos like this.